Welcome to episode 39 of the Pulse of Physiology. I'm your host, Dr. Jim Davis, and today we're breaking down stroke volume, which is the amount of blood ejected by the heart, usually we're talking about the ventricles, in a single contraction. Stroke volume plays a critical role in regulating cardiac output, which ensures the body gets the oxygen and nutrients it needs. In our next episode, we'll dive into the Wiggers diagram, which provides a detailed view of pressure, volume, and electrical changes during the cardiac cycle. But for now, let's focus on stroke volume and the factors that influence it. So stroke volume refers to the volume of blood pumped out of the ventricle during a single systole. It is calculated as end diastolic volume minus end systolic volume. End diastolic volume is the amount of blood in the ventricle at the end of diastole, or just before contraction starts. End systolic volume is the amount of blood left in the ventricle at the end of systole, so at the end of contraction, just before filling resumes. For example, if end diastolic volume equals 150 milliliters and end systolic volume equals 50 milliliters, then this means that the ventricle pumps 100 milliliters of blood per beat. Now there are three main factors that influence stroke volume. You've got preload, which corresponds directly to end diastolic volume, contractility, also known as inotropy, and afterload, which is the resistance to ejection. So preload refers to the degree of stretch in the ventricles before contraction. It is determined by venous return, or how much blood is returning to the heart. According to the Frank-Starling Law, increased preload leads to stronger contractions. This happens because stretching cardiac muscle fibers increases cross-bridge formation, leading to a greater force of contraction. More venous return equals a higher end diastolic volume, which equals a greater stroke volume. Contractility, also known as inotropy, refers to the strength of ventricular contraction at a given preload. Positive inotropic agents, such as sympathetic nervous system activation, using epinephrine and norepinephrine, increased contractility, which lead to a higher stroke volume. Negative inotropic agents, such as certain drugs like beta blockers or calcium channel blockers, reduce contractility, which will decrease stroke volume. The sympathetic nervous system plays a key role in enhancing contractility. Norepinephrine binds to beta-1 adrenergic receptors, which activate the G-alpha-S pathway. This pathway increases cyclic AMP levels. Cyclic AMP then activates protein kinase A, and protein kinase A increases or enhances the activity of the calcium ATPase pump on the sarcoplasmic reticulum. Ultimately, this results in greater calcium release during subsequent contractions because there's a larger gradient. Since more calcium is released from the sarcoplasmic reticulum, this will lead to stronger contractions and increased stroke volume. Then there's afterload. This is the pressure in the arteries that opposes ventricular ejection. High afterload increases end systolic volume, which reduces stroke volume. So in other words, less blood is leaving the heart, which means there's going to be more blood in the heart at the end of contraction. Conditions like hypertension increase afterload, making it harder for the heart to pump blood effectively. Low afterload, such as what happens during vasodilation, reduces resistance and allows the heart to eject blood more easily, ultimately increasing stroke volume. And we will talk more about afterload as well as preload in the pressure volume loop episode. So let's summarize with four key takeaways. Stroke volume equals end diastolic volume minus end systolic volume. And this represents the amount of blood ejected from the ventricle each beat. Preload, which corresponds directly with end diastolic volume, follows the Frank-Starling Law, where increased stretch of the ventricular walls leads to stronger contractions. Contractility, or inotropy, is influenced by the sympathetic nervous system and affects calcium availability and force generation. Afterload opposes ventricular ejection, with higher afterload reducing stroke volume. And so that's it for episode 39 of Pulse of Physiology. I hope this episode has helped clarify the factors that influence stroke volume and how the heart adjusts force generation. Join me next time for episode 40, where we'll analyze the Wiggers diagram and explore the dynamic events of the cardiac cycle. Until then, keep questioning, keep exploring, and stay curious.